friends, welcome again to another session of our lab test chat. Why doctor ordered this test? Last week we took a look at the complete blood count test. I tried to cover as much as I could, and I hope you learned a lot. This week we'll be looking at another test, the PT-INR test, prothrombin time. How important is it to get this test done? Let's find out. What is the PT-INR test? That's the first thing we want to look at. The prothrombin time, sometimes referred to as PT-INR or ProTime test, is a test to evaluate blood clotting. Prothrombin time is a protein produced by your liver. It is one of many factors in your blood that help it to clot appropriately. So in simple terms, prothrombin time is a blood test that measures how long it takes the blood to clot. And if you have been given a requisition to get your PT test taken off, you will find that your phlebotomist will use a light blue stoppered tube, right? If the phlebotomist is using anything else, maybe dark blue or a purple top, you might want to ask, are you sure you know what you're doing? All right. So why are patients sent to do PT-INR test? There are a few reasons. Let's look at them. One, surgery, right? If your doctor may have any concern about your blood's ability to clot, the doctor may order a PT-INR test right before your surgery. Warfarin. Lots of people know about warfarin medication. Most often, the prothrombin time is monitored if you are taking the blood thinning medication warfarin. In this situation, the prothrombin time is shown as an international normalized ratio. There you have it, guys. INR stands for International Normalized Ratio, for those persons who wasn't so sure. Liver disease screening is another reason why the doctor may send you to do your PT-INR test. The prothrombin time test also may be performed to check for liver disease. It is one of the many tests used to screen people waiting for liver transplants, right? That screening, known as the model for end-stage liver disease, right, is scoring system for assessing the severity of chronic liver disease. Whenever you are sent to do your PT-INR test, because of those related reasons, right, quite often you find that you may encounter soreness or minor bruising at the site in the arm where your blood is drawn, right? And also note that patients on warfarin have the tendency to bleed longer, right? So considering this, we want to find out how we can prevent these results. So we don't want to encounter bruising, and we don't want to know that the patient gets up from the chair, or we leave the patient and the patient starts bleeding again, right? So one, patient, advise your phlebotomist that you will need to sit and press on the punctured site a while longer, right? This can help to prevent bleeding to restart, or help in the prevention or encountering a bruise. So very important, you know, press as long as possible to avoid bleeding longer and to avoid encountering a bruising on the site, right? Now, another way I must say is that butterfly needles does the magic trick. The butterfly needle is one of the thinnest needles for phlebotomists to use, so therefore causing a thinner wound to the patient's skin. So if it is that you know that you're on warfarin, or you have issues where concerns delicacy of the skin, right? or you just maybe not on warfarin, but you find that your blood is thin and you have the tendency to bleed longer than normal, then you need to request a butterfly from your phlebotomist. Quite often, it is important when a phlebotomist asks upon entry, or you on blood thinners, but not every phlebotomist will do that. So make it your responsibility as a patient to request that butterfly once you know that you're on the warfarin, you are blood thinning, you have delicacy in with your skin. Just request a butterfly, and these are how they look, right? Different colors, but they're all smaller, tiny needles. We call them baby needles, right? But if you know that you don't have any of these issues, you don't have to request a butterfly. Come on, leave it for persons who have these issues, or leave it for all babies and all children. When is a PT test possibly needed? Whenever you are having leg pain or tenderness, unexplained heavy bleeding, bruising easily, unusually heavy menstrual periods in women, leg swelling, unusually heavy nosebleed, right? Rapid heartbeat, chest pain, cough, redness or red streaks on the legs, trouble breathing. These are some of the common reasons for you needing to go into your doctor to report the issue, and then your doctor possibly may order a PT-INR test. What are some of the common diseases and abnormalities that the PT-INR test can diagnose? Let's look at the thrombophilia. So is when the blood has an increased tendency to form clots, right? Anybody ever said to you, I think my blood is thick? Yes, right? Sometimes that's how they refer to it. Your blood has increased tendency to form clots. You refer to it as a thrombophilia. We also have the liver disease. Diseases caused by drugs, poisons, or too much alcohol, right? So guys, there you have it. Please, if you're doing drugs, stop. That's number one. Number two, if you're taking alcohol, make sure to limit your intake. I would tell you not to, but then I can't tell you what to do. So I would say limit your intake, right? And of course, pay attention to what you eat. You do not want to encounter any form of poisoning, right? So protect your liver, please. Don't do what you shouldn't do. Don't do what I wouldn't do. Okay, so hemophilia is another one. A bleeding disorder, a condition in which the body can't clot blood properly, causing excessive bleeding. So you have the thrombophilia and you have the hemophilia. So one is when your blood have a tendency to form clots, so your blood is thick. Anyway, and the other one is when your blood is so thin, right? So it is like your blood cannot clot properly, right? Another one is the vitamin K deficiency. Quite often we pay attention to our vitamin A, vitamin C, and vitamin B and D levels, but we don't pay attention to vitamin K. Quite often we don't hear of it. But let's say this plays an important role in blood clotting. So if you're not checking up with your vitamin K levels, go ahead and do that now, because it plays a very important part in blood clotting, right? Okay, guys, so what did we go over today? We looked at what is the INR test is, the reasons for your doctor requesting the test. We looked at common occurrences when testing, right? And we spoke about how we can